bodies function normally with the help of one small, butterfly-shaped gland, the thyroid. The thyroid gland regulates your body's heart rate, blood pressure, temperature, and metabolism. Thyroid nodules are abnormal overgrowths of tissue in the thyroid gland that interfere with the proper function of the thyroid gland. Thyroid nodules can be solid or filled with fluid, which are often benign, but about 5% can be cancerous. Occasionally, however, some nodules become so large that they can cause swollen lymph nodes, tight feeling in the throat, hoarseness and coughing, difficulty breathing and swallowing, and vocal changes. A thyroidectomy, conventional surgery, is one option to remove thyroid nodules. But surgery leaves a scar, requires hospitalization, general anesthesia, a lifetime of medication, and some patients experience hypothyroidism. However, thanks to an amazing, minimally invasive, non-surgical treatment called StarMed radiofrequency ablation, you can avoid surgery altogether. The StarMed RFA procedure can safely and quickly remove large, uncomfortable thyroid nodules that can be performed in either an outpatient or hospital facility. The benefits of StarMed RFA are minimally invasive procedure, no general anesthesia, no unsightly scarring, short recovery time, and no lifetime medication. After the nodule is located using ultrasound guidance, the physician inserts the StarMed RFA electrode directly within the nodule. Using a radiofrequency generator, the doctor allows a carefully controlled amount of energy to flow through the electrode into the tissue to ablate the nodule. With the sustained RFA thermal heat, the nodule is degenerated, and the degenerated tissue flows through the body as wastes. In a follow-up study, nodules consistently decreased by 93%. Hormone-producing benign nodules were reduced by 53 to 71% in 6 months. Blood hormone levels completely normalized in 82% of patients, and medication was no longer required. Radiofrequency ablation is a minimally invasive, reliable alternative to surgery.